I think it's recording. So hello, my name is Alex Durgheu. This is the head-to-toe assessment as part of a test that I need to do for this class. Here's my ID. I hope you see it properly. There you go. And we have our subject here, who I'm gonna say his initials is CM. I'm gonna have to ask him for consent to be recorded. Do you agree to be on record?
Yes.
Okay, he is a 21-year-old male. So my name is Alex. We're gonna perform a head-to-toe assessment. Can you tell me what day is today? Do you know what day is today?
Today is Tuesday.
Excellent. Do you know who's the president of the United States?
Donald Trump.
Okay, appears that the subject is alert and oriented times 4. So we're gonna commence on, hold on, I'm gonna look for some gloves. Okay. I'm back. I performed hand hygiene. Put the gloves on. And then first I'm going to start with the skin and nails. So I'm looking at the skin. I do not see any scars, any lesions. Can you please take off your shirt? Just leave it there. Yeah, nothing on the chest, not on the back. Okay. I'm looking at the nails. The angle looks good. The lunula looks good. The cuticle. I'm pressing for capillary refill, which seems to be under 2 seconds. Let's take off the.
And you both me.
Yeah, both. Thank you. The same manner, I do not see any lesions. The color is appropriate for the race, is normal. I don't see any others, so I'm gonna go ahead with the hair. The hair looks thick. The color is, I don't know, blonde, reddish maybe. I'm looking at the turgor. It seems to be elastic, which means well hydrated. And then I'm gonna go and look at the neck. I see the trachea in the middle position, properly possessed. I'm checking for thyromegaly, which I do not think. Can you please swallow? Excellent. One more time. Excellent. Can you look there, please? I feel the carotid pulse. Okay. Then we're gonna go ahead and look at the face features. It looks symmetrical. It looks normal. Color is normal, and maybe we should auscultate the for the neck the carotid artery with the bell. Can you do your right, please? I'm auscultating for bruits. No bruits. I just hear the normal heart, the pulse, loud and clear. Excellent. Now I'm gonna palpate the lymph nodes. Can you bend your head? This is the, yeah. Palpating for occipital nodes. This is preauricular, postauricular nodes, lymph nodes. I don't feel anything. Anterior cervical nodes, posterior cervical nodes. I'm gonna look for axillary nodes. I don't feel anything. Epitrochlear nodes, right here. We do this bilaterally. Axillary nodes again. I don't feel anything. Excellent. Okay. Yeah, right. These are the supraclavicular nodes. Excellent. All right, then I'm gonna start with the eyes. I'm looking at the eyes. I'm looking at the eyelids. No sign of ptosis. There's symmetry. Um, I'm gonna look at the conjunctiva, pink and moist. Lacrimal glands. The sclera is white. No sign of jaundice. And I have to mention here to check the vision. I have two kind of vision test cards. One is the Snellen, oh here, and the one is the Rosenberg. The Snellen contains letters only. The Rosenberg contains some numbers, E's, X, and O's. This one, this particular size should be used at like about 36 centimeters from the eye. We're not gonna do that. And the Snellen, this size should be posted like about 6 feet from the patient. Where am I at? Hold on. Yeah, like 6 feet distance. All right. So that being said, I'm gonna look into your eyes. You're gonna see some light. It might be uncomfortable, but we're gonna do this pretty fast. So you just look in the eyes. I'm gonna start going towards you. I see reaction. I see red reflex. I see, if I have to look closer, okay, right eye in the right is patient's right eye, the same here. I'm watching for the optic disc, retina, vessels, arteries, and veins. And now we're gonna check for perla. I'm gonna put again some light just to see how your pupil reacts, okay? Excellent. Pupils are equal round, reactive, and probably they accommodate. Look at the that picture on the wall, please. Look there, and now look at this tip. Excellent. The pupils are accommodating. Can you follow my finger, please? We're gonna do down, down here, up, back, from the side. It seems that the eyes are moving in all 6 quadrants. Next, being done with the eye, we're gonna do the ears. For ears, I'm gonna inspect again and looking at the shape, color of the skin, and I'm looking at the imaginary line in between the inner canthus of the eye towards the back of the head, and it seems that the auricula is situated above that imaginary lane, which is a normal sign. Okay? I'm going to use the otoscope to look in a patient's eye, like, and I'm going to pull the auricula. It's pulled up and back. for the adults. For the pediatric patients, we have to pull down and back. Well, our subject is considered adult, so I'm gonna look back. I see the tympani, a little bit of cerumen, which is normal. The same here, bilateral. Okay, a bit of palpation. I don't see. Do you feel any pain? They are firm, so it's excellent. Now to test the hearing, I want you to close your eyes. Do you hear anything?
Yes.
What do you hear?
Some crinkling
Where?
in my right ear,
How about now?
left ear. 66. 99.
Excellent. All right. So now we're gonna look in your nose. I'm looking at the symmetry. It's symmetric. I don't see any signs of inflammation. Oops. Just tilt your back. Okay. Normal and dry. No septum deviation. No septum damage. Also now I'm looking at the lips. I'm gonna palpate them. Keep your mouth shut. Any pain? Okay. Palpating the gum. I'm not gonna put the hands in the subject's mouth right now. Open your mouth, please. I'm looking at all the teeth here. Let me open. Excellent. The gums look healthy. Palates are healthy as well. I'm gonna look for uvula. It's symmetric. I'm looking at the tonsils. They are not inflamed. I see the soft palate. I believe I forgot to palpate your tonsillar nodes and also submandibular nodes and submental node. Submental node, it's only one here up front, I believe. That being said, mouth, gums, I'm going to keep going towards the chest. We're done with the face. Now, oh, we have sinuses. Let me palpate your sinuses. Do you feel any pain? Palpating the face sinuses, which are at the zygomatic, under the zygomatic proeminence. We can try to see if we have transillumination. We should turn everything off. Can you turn, open your mouth, tilt your back, head in and back. Normally we should see, but okay. I do not see it. So next, we're gonna go ahead. We did the neck, we did the throat. I'm gonna inspect the chest, the upper torso. Okay, like this. I'm looking at the diameter. No signs of barrel chest. Respiration appears to be normal at about 17 breaths a minute. So we're gonna go ahead and auscultate the chest, comparing the sound to side to side. Okay, with the diaphragm. Just breathe normally, excellent. I do not hear any adventitious sounds, no wheezing, no ronchi, no stridor. Breathing seems to be unlabored without using the accessory muscles. Excellent. Oops. Can you please turn? Yeah, just place there. So in the same manner, we're gonna auscultate the back. Breathe normally. We gotta make sure the auscultation goes in between the scapulae. Okay, can you turn towards the wall, please? And I look for tactile firmitus. Say 99.
99.
Excellent resonance. We're gonna check the thoracic diaphragm expansion. Take deep breaths. Excellent. This is gonna be at the intercostal angle. Okay, turn back, please.
All the way around.
Yes. We're gonna start do some percussion on the chest in the same manner we did the auscultation, in the same sequence. We have clear sounds. Was a little different over the heart. No dullness, no signs of anything wrong. Do it here. Hitting with my middle finger, the middle finger's last phalange. Excellent. Alright, next I'm gonna move to assess the heart. Okay, for the heart, I'm gonna assess for the rate, rhythm, starting. The heart needs to be auscultated in 3 positions: sitting upright, supine, and recumbent position. All of them should be auscultated. Well, the sit upright is going to be auscultated with the diaphragm. I'm going to start at the second intercostal space, right next to the right of the sternum. This is the so-called aortic valve. Excellent. Pulmonic valve. If I go down at the third intercostal space, is the second pulmonic or Erb's point. Lower than this, we have the tricuspid valve. Excellent. And the last one is the mitral, or the apex of the heart. I heard S1, S2. I'm gonna feel for pericardium, precordium. Just check it out. Gonna touch the heart. Excellent. Can you look towards the left, please? Excellent. The bits are synchronous. So also for the in a supine position, we would listen with the bell of the stethoscope. Okay. So we did have the chest. We did have to. Now I want you to lay down, please, on your back. Easy, easy. Okay. So again, for heart, just to emphasize, with the bell this time, aortic valve, pulmonic, second pulmonic, or herbs, tricuspid, um, apex. Okay, moving forward. Let's let okay. To the abdomen, I'm gonna assess the symmetry. Color is good. Can you lift your head? It's okay, thank you. There is no muscle bulging and no signs of hernia. We're gonna start auscultating the abdomen in all the four quadrants, starting with the fourth lower one. We're gonna listen for the bowel sounds. Excellent. 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 Now I'm gonna lightly palpate for masses, no tenderness, no masses. I'm palpating for the liver, which is at the costal margins. Okay. No splenomegaly here. Also for the extra points, I'm going to do the check for the Murphy's sign. When I push with my right hand under the right costal margin, all the way deep, and I let it to rebound. Patient has no reaction, which means negative for Murphy's sign, which would trigger further assessment for cholecystitis. At the deeper palpation, do you have any pain? Do you feel anything? Abdomen appears to be soft, feeling all the organs, including the kidney. Excellent. Okay, you can sit up. So after abdomen, I believe we have the blood vessels. For blood vessel, I'm just going to check your pulses. There is apparently at the temporal. I can feel it here bilateral. Carotid pulses. Okay, excellent. You have brachial pulse. This is the radial. Okay. I'm gonna do dorsalis, but can you just lean on your back again, please?
All the way back?
Yeah. Dorsalis pedis. Excellent. Loud 2 plus. I love strong 2 plus. Pulses. And internal tibial. Okay. Since you like that, let me just, I forgot to percuss the liver. Okay. Percuss the spleen. Okay. And the epigastric area sounds kind of empty. You need to have more breakfast. All right. You can sit up, please. So after the blood vessel, we do the musculoskeletal check musculoskeletal. Oh, range of motion, I believe. Okay, do with your head like this, side to side. Excellent. Back and forth. I'm looking this 90 degrees. Can you stand up, please? Put your arm up there and straight. Move it forward all the way. Okay, that's good. With the other one, please. Yeah, no, from up all the way on the other side. Excellent. I'm looking at the posture, which is normal. Can you walk there and back normally? Okay. Gait is normal. Come back. Excellent. You can sit again. So we check the shoulder. We check your elbow range of motion, and then we change. We look for this is bilaterally. Can you stand up again? I forgot about the to check your spine. It seems to be straight. Can you bend forward 90 degrees? Okay. Excellent. I'm looking the scapula in the same line, so no signs of scoliosis. Okay. Now, we need to check the wrist. Can you? Oh, I believe we out of the camera. Can you sit here? Okay. Keep your hand. Put your wrist down. Okay, up maximum. Excellent. Excellent. Do this one, the same. Can you do the finger, forward, back, maybe do a fist? Excellent. With the left hand. Okay, perfect. Now with the hip, I want you to lean on your back again. Elevate this leg always upright. More, 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 more. Okay, put it down. The other one too. Okay. I want you to move a little bit higher. Okay. Now bend this knee. I'm still checking for the hip mobility, range of motion. Okay, the other one. Excellent. Okay, go back. And now flex your legs and back up. Do the other one bilateral. I don't know if people see that. Yeah, okay, excellent. Can you stand again? Bend your knee like this to see maximum as you can. Excellent. Now hold it straight. Excellent. The same with the left leg. Okay, okay. You can sit back. This is done with the muscles. Okay, now we're gonna do the neuro check. We have a bunch of cranial nerves here that we need to follow. So I want you, can you frown to me? Frown, okay. Lift your eyebrow. Let's do this so the people can see. Okay. Yeah. Shut your eyes. Shut it. Strong. Excellent. Elevate your eyebrows. Elevate them. Excellent. This is the cranial nerve 5 that we're checking right now. Is the facial cranial. Okay, can you smile? Okay. Show me your tongue. More. Out. Move it left to right. Excellent. Excellent. That was the hypoglossal cranial nerve 12. Can you shrug your shoulders Excellent. This is cranial muscle 11. 10 is the vagus nerve. 9 is glossopharyngeal. And 8 is the hearing one, which we check the hearing, which sounds good. 7 is the facial muscle, and 5 is the trigeminal. Okay, we saw that he can move all the muscles and so forth. Can you look at my nose? How many fingers I'm wiggling here?
2.
Excellent. How about now?
2.
Okay, now here?
1.
Excellent. And here?
1.
Excellent. So the peripheral visual are excellent. No signs of um, um, visual field issues. I want you to do this fine motor skills. Do this fast as you can with both hands. Yeah, excellent. Excellent. You can squeeze my hands stronger. Okay, that's good. Also, I want you to look at my finger. I want you to touch with your index my finger. Touch it, and now touch your nose. Touch my. You
Good.
can look.
Okay.
Yeah. Okay, and back. Excellent. So it seems that you're doing fine in that area. I'm gonna tell. I want you to close your eyes. Shut your eyes. Did you feel this?
Yes.
Tell me what you feel.
I felt a touch on my bicep,
Okay. How about now?
on the forearm,
Okay. How about now?
the right forearm,
Okay.
right or left bicep, left knee, right quad, right shin, left shin.
Okay. Excellent. Now I'm gonna try. Can you? Yeah. Let's see. Do you feel anything? So you should hold on. Let me hold this. How about now?
Yes.
What do you feel?
Vibrating.
Yeah, probably we cannot. It's got to be over bony proeminence. Let me see this. Feel it?
Yes.
Excellent. All right. That being said, neuro-wise, I believe I'm done. No, reflexes. Okay. Now I'm going to check your reflexes. Okay. Put your hand over my forearm. Yeah, like this.
Mm-hmm.
I'm going to check your biceps.
Okay.
Relax. Okay. Lift it more. Okay. Excellent. The same manner we're going to do the brachioradial reflex. Whoop. Okay. The same manner here. I'm gonna have to do this because I'm right-handed. Just flip, yeah. Okay. The same here. Okay. Okay. So now we're gonna check the patellar reflex. Woo! I'm sorry.
No, that's
Was it
good.
too hard?
No.
Okay. So we did this, that, and okay. And also Achilles reflex. Okay. Okay. Excellent. That being said, I believe that's all. Oh, plantar reflex. Okay. All right. That's now for extra points. I'm gonna do the Weber test. Okay. I'm gonna put this fork on top of your head. Tell me what you hear. Do you hear anything?
Maybe like a low vibrating.
Okay. Which ear you hear it better?
Can you do it again, maybe?
Oops. Oops.
Maybe left ear. I'm not too sure.
Okay, more like equal.
More equal.
That's excellent. We're gonna do the rhyme test, in which we're gonna put the fork behind the ear, which is the mastoid process, and we're gonna count for how many seconds you're gonna hear this sound. We're gonna do it bilateral, and then also we're gonna do it without touching your bone, okay? So let's do this. Do you hear anything?
No.
Maybe I should use the other one. Do you hear anything?
No. There it is. Yeah. Still hear it.
So
Low vibrating.
5, 6, 7, 8, 9. Do you still hear it?
Yeah. Still hear it.
10? Still?
Okay, it's fading now.
Okay, it's fine. Okay. Now, I wanna tell me when it stops, when you stop hearing it.
Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19.
Okay.
So this is a negative rhyme test because the bone acoustic lasts about half than the air acoustic. So, which is a normal finding. We're gonna do the same here. 1, 2, 3, 4, 5, 6, 7.
It's done.
It's done. Okay, and now okay, it's clear that it's double. I want you to lay on your back again, and I'm gonna try to perform the so-called, can you get, yes, excellent. The drawer test, that's excellent. Bend this knee, and I'm gonna pull to check for your knees ligaments. Excellent. Do the other one. Relax, relax.
Just relax.
Okay. Excellent. Excellent. So apparently there are no disorder there. What else for extra points? I'm not sure. So we did the Murphy test, we did the drawer test, we did the Weber test, we did the Rhine test. I believe this will conclude our head-to-toe assessment. Thank you everyone for watching. Thank you to CM, our guest here. Have a great day, everybody.